broadcasting from Miami. We have tonight another in the series of Parkinsonism educational hangouts with Dr. Abdul Rana from Toronto, Canada, a neurologist and a world-renowned Parkinsonism educator. This also can be seen live on Parkinsonism.tv. Tonight, Dr. Rana is going to be talking about swallowing problems in Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
How are you tonight?
Fine, thank you.
Is it freezing up there in Toronto?
No, it's better.
It's not sunny yet, is it?
No, it's sunny. It was very sunny today.
It's very unusual.
Yeah,
Okay.
we're in March now.
It's not like Regina. Okay, swallowing problems in Parkinsonism. How is normal, I guess we'll go over the normal physiology. How is normal swallowing initiated?
Swallowing is a very complex activity, and it includes three phases: the oral phase, pharyngeal phase, and the esophageal phase. The hypoglossal nucleus and the nucleus ambiguus of the brainstem, these are the main motor nuclei which are involved in the swallowing reflux. The neurons of the dorsal motor nucleus of vagus, they control the activity of the muscles of esophagus, and swallowing is then initiated by the medullary motor pattern generator. There is a sequential activation of the oropharyngeal muscles during the act of swallowing. The medullary swallowing network receives the input from the cerebral cortex and some subcortical nuclei.
Okay, how is the swallowing problem related to Parkinsonism?
About half of patients with the Parkinson disease report trouble with swallowing. But if you do video fluoroscopy, then you can detect that about 90% of patients would have some dysfunction of swallowing. It could be partial. There could be an isolated deficiency of a phase like oral, pharyngeal, or esophageal, or it could be combined dysfunction of two phases or all three phases of swallowing. And this dysfunction causes the poor bolus formation. There is lingual fascination. There is repetitive tongue elevation during oral phase, delay of swallowing reflux, and the transit time of the pharyngeal phase could be slow, and there could be pooling of the piriformis sinuses during the pharyngeal phase, and the upper esophageal sphincter may not relax completely, or the esophageal peristalsis could become slow, and sometimes the gastroesophageal reflux could cause problem. Usually the swallowing problems are seen in late stages of Parkinson's disease, like after maybe a few years of onset of Parkinson's disease, and they don't usually occur at the onset of the disease. If the swallowing problems occur at the beginning of the disease, then the diagnosis could be atypical Parkinsonism, such as progressive supranuclear palsy. The patients with progressive supranuclear palsy may have the swallowing problem at the beginning of the onset of Parkinson's disease. And unfortunately, the swallowing problem does not respond to dopaminergic medications, which may indicate that just the dopaminergic deficit may not be responsible for the swallowing dysfunction, and there could be involvement of other neurochemical systems. Some reports have suggested that subthalamic nucleus stimulation may improve the timing of the pharyngeal phase, but it does not affect the oral phase of swallowing. And there has been some reports that the swallowing problem in Parkinson's could be due to pedunculopontine tract problems, which provides a cholinergic input to the nucleus of tractus solitarius, which is a critical component of the medullary pattern generator of swallowing.
What are the consequences of swallowing problems? What happens to patients when they have swallowing problems?
The swallowing dysfunction could lead to quite serious consequences. Sometimes patients could choke when they are eating, they could cough when they're drinking liquids, and it could lead to aspiration pneumonia. And Then due to this, patient may decrease their oral intake, and sometimes it could be quite serious. I had a patient who was eating at his home, and he started feeling trouble with swallowing. He was eating fish. So when he could not swallow the bolus, so the family was quite anxious, and he became a bit short of breath, and they called 911. Paramedics arrived. So everyone thought that there was a bone in the fish which got stuck in his throat, so he can't swallow because of the bone. So there was a big panic in the house, and when the paramedics arrived, fortunately, wife who was gone out, she came at the same time, and they said to her that dad is choking and he has the bone which got stuck in his throat. He was eating fish, but she said it's a boneless fish. There's no bone in this fish. So it was quite, they couldn't understand what is causing this. So the paramedics started tapping on the back of his chest and tried to give him liquids. So finally he was able to swallow and he was able to catch his breath. Right. So sometimes the patients could run into many serious problems. So you could assess it simply by giving a patient a few sips of water. If they drink and they start coughing with it, then these patients should have a formal swallowing study, and they should seek the opinion of a swallowing therapist.
Yeah, barium swallow, right? What are the consequences of swallowing problems? I guess you kind of went over some of them.
Right. Swallowing could cause, the main risk is aspiration. So aspiration pneumonia could happen because of the food going into the airways, and then these patients they can run into problem. They sometimes may need antibiotics. Sometimes they need to be admitted to hospital, and you know, hospitalization has its own complications. So once you go to hospital, so some patients unfortunately get sicker and sicker. They get so many diseases, and they get PE, or they get deconditioned, and so many problems happen to them. So if you prevent it from the onset, you can definitely prevent all the complications or consequences attached with the swallowing problem.
Okay, and how can these problems be managed?
Swallowing problem could be difficult to manage sometimes, because not many medications would help swallowing problem. So swallowing studies are needed usually to rule out other causes of swallowing problem, and patients should also plan a longer time to finish their meals. They should try to chew food slowly, and if you swallow small liquids with solid food when you're chewing, so it does help in swallowing. Also, patients should be careful that the food should not be too hot. Eating soft foods like jello, yogurt, or applesauce may be easier. And also swallowing at least twice when you are eating solids. So swallowing twice might help. Sometimes putting a small amount of food in mouth is helpful. Also, lowering the chin to the chest when you're swallowing, it does prevent aspiration. And of course, you need an assessment of speech and swallowing therapists, because they can give a focused attention and they can give much more advice to this problem, as no drug treatment is helpful for this type of problem. Some reports do suggest that anticholinergic medication could cause some improvement, but I think it's controversial, because in some cases they may cause worsening of dysphagia. And botulinum toxin injections have been tried in cricopharyngeal muscles, and some reports of success are there in literature, but they have small number of patients, and also there are not many experts who can inject these complicated sites. There was a study which reported that the patients who have dyskinesias, they have better swallowing function than those who are non-dyskinetic. So So it could suggest that the higher doses of levodopa probably could help to some extent, but most patients would end up being on a soft diet or eating the stuff like yogurt or jello or applesauce or minced diet. And in some cases, in the advanced cases of Parkinson's disease, patients may require a gastrostomy tube to be fed.
Well, I'm going to ask you a question I probably should have asked with some other things you talked about, but is the difficulty swallowing a progressive thing, like invariably it gets worse, or is it sometimes just go away and get better?
In the beginning of this problem, patients may have a very mild problem, like they may just occasionally cough or choke with liquids, but it does get, as disease progresses, it does get worse, and then patients start having trouble with eating regular food, and then they start aspirating, and slowly it gets worse, and if they are not careful, then the patients do get aspiration pneumonias, and with the advanced stages of Parkinson's disease, I mean, they do require soft foods, and they are not able to eat a piece of steak or foods which can which require a significant chewing and swallowing act. So yes, it's a progressive problem which starts very mild, but with time it does increase, and patients should be educated. They should be educated in time so that they can prevent complications.
Okay, very good. Anything else to add before we close on swallowing and Parkinsonism?
As always, I think screening is very important because patients may not report these issues. So you have to take the lead of asking them, do you cough or choke when you're eating, or you have any trouble with swallowing? Then you should try to differentiate if they have trouble with swallowing liquids versus solids, because in most neurological issues, the swallowing trouble with liquids may be more pronounced than with solids, as compared to some anatomical issues such as esophageal mass or something like this. So that could cause more trouble with solids. And also, in some cases, if you don't suspect that it could be due to Parkinson's, so some other causes should be ruled out, such as esophageal tumor or ecclesiocardia, and there are so many things which can happen which can cause the swallowing problems. So these things should be ruled out. So patients do need swallowing studies and proper follow-up for this type of problem. If patients have systemic symptoms such as weight loss and fever or sweating, then the physician should look for systemic causes as well, because just attributing the swallowing problem without proper screening and ruling out other causes could lead to ignoring some serious causes which need management in a timely fashion.
Very good. Okay, Dr. Rana, thank you for another good hangout on Parkinsonism, swallowing and Parkinsonism. All these videos, as well as a lot of other education videos on Parkinsonism, are on Parkinsonism.tv. Okay, thank you, Dr. Rana.
Thank you very much, Dr. Bennett.
Okay.